It all started when I hurt my knee playing football. I tore my meniscus, and for a few months I was actually living with the pain. I was able to do my day-to-day activities, but it was limiting for playing sports or doing trekking, which is something I do enjoy. So I finally made the decision that it's time to actually go in and get it fixed. So with that process, I started doing my research initially on which hospital am I gonna choose. I figured that's step one. After extensive online research, Zulekha Hospital, which ranks in the top 5 in the UAE, according to several studies I looked at and several criterias that I've read extensively about. So it was definitely one of the options. I looked on their website. I knew I was looking for an orthopedic doctor. I looked at the profiles of, all the orthopedics available there. Frankly speaking, I had a hard time choosing because, and you can go check that out yourself, all the available orthopedics had, very high qualifications, great amount of experience. I ended up choosing Dr. Iyad, big part of it because he's a consultant orthopedic. He's also, from what I remember, from the German board certified. And I had my first consultation with him. Walked into Dr. Iyad's office. He took his, time testing my knee and figuring out what was wrong with it, looking at MRI reports, the whole 9 yards. It was a very thorough examination, which frankly was expected. Okay. What was not expected and was a very, very pleasant surprise to me is that he took an additional considerable amount of time educating me without me asking him on how the knee works. So he got a actual, knee skeleton and went through the whole functionality of the ACL, PCL, patella, meniscus, the functionality of each and the whole 9 yards. Then he narrowed it down to, okay, this is where your problem is with the meniscus, with the medial meniscus. This is where it's torn, and he went through explaining the functionality, the limitations, and the whole 9 yards. After that, he went through all the options of, whether if we don't repair it, the pros and cons of it, whether if we go for a surgical treatment, the pros and cons of it, and the whole 9 yards. So it was extremely thorough and informative. And with that, I was actually planning on, seeing multiple doctors and seeing, having different opinions. That's generally normally how I like to do things. But when you found the right doctor, you know that you found the right doctor. I mean, when something feels right, it feels right. And walking out of his clinic after the first consultation, I knew it right then and there. Done deal. This is the doctor. This is the hospital. And I'm gonna go through with it. Yeah. Call it intuition, call it whatever you want to call it, but when it feels right, it feels right. It takes, I believe, a lot of factors to make something like that happen, and all the factors were there during that visit. Sure enough, I proceeded with the operation. The experience was, I would say, extremely pleasant, relatively speaking. I mean, it's still it was still a surgery, anesthesia, the whole 9 yards. But when it comes to that, it was actually quite a pleasant experience. I felt assured I'm in good hands. The hospital, with all of its operation, from the room to the nurses to, everything was as good as it gets. I cannot ask for anything more. The surgery, which is the most important thing, obviously, is exactly as Dr. Iyad set the expectations for it. And I initially thought that probably unrealistic expectations, that right after the surgery, from the second day, I will walk out of the hospital on my own 2 feet without crutches. And sure enough, that's what I did. And few days, right now, a few days after the surgery, I'm actually taking walks, a kilometer plus, walk with, I'm not 100%, but I'm functional. And as Dr. Iyad is setting the expectation, which I have come to fully trust at this point, that within another 2 weeks to 3 weeks, I should be, back to 100%. And I can actually see the progress day to day. So all in all, an extremely pleasant experience. I would highly, highly recommend it. Both the hospital and Dr. Iyad specifically. I'm quite happy, quite satisfied. Can't ask for more.
Hello, this is Dr. Iyad Al Souri. I am a consultant orthopedic surgeon as well as trauma and spinal surgeon. I'm working now as an expert in orthopedics, sport medicine, and in arthroplastic surgeries. Today, we're going to talk about an interesting experience of one of my patients, which I have treated him before a couple of days. This gentleman is Mr. Bassam. Mr. Bassam, he is a middle-aged patient, around 46 years old, came with a severe pain of the knee joint since a couple of years, and he was operated previously before a couple of years at the same knee joint. Bassam presented his illness at the time he visited my outpatient clinic as an onset of continuous pain, which is irritating him from doing his regular activities and from doing his regular sport. After the examination and the needed investigation, we decided together, me and my patient, to go for the surgical option of treating his current illness. And we have operated him before a couple of days. We made him an arthroscopy of the knee joint to treat his present illness. The worries that Bassam used to have before the surgery, which many patients they would like to ask, and they would like to make sure that these questions can be answered in a professional and frank and honest way. One of these questions was, can I walk at the same day, for example? Is it going to be swollen and painful, as well as my movement restriction after the surgery? The third question, how fit can I move and walk after the surgery and get back to my normal activities? As we usually make, we talk frankly and open to our patients, and we explain them the real onset and the real expectation after the surgery. I have found especially interesting in this case that Mr. Bassam himself, when he compared the outcome of the surgery now and previously, the first question I saw after the surgery, doctor, well, I don't have a swollen knee and I can walk at the same or the next day, which I really did not expect. Of course, such statement of the patient makes me very happy and make me very thrilled for the outcome of the patients. And I would like to emphasize here, the outcome for each patient is individual, but at the same time, we keep in our work the high international standards with the minimum invasive surgery methods and techniques that we used. And I have personally worked as a consultant orthopedic surgeon in Germany for a long time. And at the same time, I am a German board certified for orthopedics and trauma surgery. So we used for our patient the most less invasive surgeries with the higher international standards to get them fit, back, and fast to their normal life.
Discover the ultimate healthcare experience.